and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Long-term arsenic exposure may be risk factor for cardiovascular disease. Long-term exposure to arsenic in water may increase cardiovascular disease and especially heart disease risk even at exposure levels below the federal regulatory limit, according to a new study at Columbia University Mailman School of Public Health. This is the first study to describe exposure-response relationships at concentrations below the current regulatory limit and substantiates that prolonged exposure to arsenic in water contributes to the development of ischemic heart diseases. The researchers compared the various time windows of exposure, finding that the previous decade of water arsenic exposure up to the time of a cardiovascular disease event contributed to the greater risk. The findings are published in the journal Environmental Health Perspectives. To evaluate the relationship between long-term arsenic exposure from CWS and cardiovascular disease, the researchers used statewide healthcare, administrative and mortality records collected for the California Teacher Study cohort from enrollment through follow-up, identifying fatal and not fatal cases of ischemic heart disease and cardiovascular disease. Working closely with collaborators at the California Office of Environmental Health Hazard Assessment, the team gathered water arsenic data from CWS for 3 decades, from 1990 to 2020. The analysis included 98,250 participants, 6,119 ischemic heart disease cases, and 9,936 CVD cases. Leveraging the extensive years of arsenic data available, the team compared time windows of relatively short-term to long-term average arsenic exposure. The study found decade-long arsenic exposure up to the time of a cardiovascular disease event was associated with a greater risk, finding peak mortality of acute myocardial infarction around a decade after a period of very high arsenic exposure. This provides new insights into relevant exposure windows that are critical to the development of ischemic heart disease. Those exposed to 1 to less than 5 microgram per liter had modestly higher risk of ischemic heart diseases with increases of the 5 to 6%. Risk jumped to 20% among those in the exposure ranges of 5% to less than 10 microgram per liter and more than doubled to 42% for those exposed to levels at and above the current EPA limit, that is equal to or more than 10 microgram per liter. The relationship was consistently stronger for ischemic heart disease compared to cardiovascular disease, and no evidence of risk for stroke was found, largely consistent with the previous research and the conclusions of the current EPA risk assessment. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.